Hello, I'm Dr. Lochemes. I'm here to go over some common foot and ankle problems that you might encounter in yourself. We're going to use a model, Adam, to go over some of the anatomy, and I'm using his own foot as something that you could reference on yourself to help begin to understand what might be going on you, and then give you some indications of whether you should come in and get it further evaluated. Some common foot and ankle problems that you'll see is people have bunions. A bunion is a old Latin word for turnip, and they thought that the area of prominence of the metatarsal here looked like a turnip. So a normal toe is typically lined like that. Our model here, Adam, has a little bit of a bunion. Now, if bunions don't hurt you, there's no need to really do anything other than maybe shoe wear that accommodates it, or even a little toe spacer for in between the toes. But so the common area of problems would be this prominence of the metatarsal head called a bunion. The other thing that we can see is a neuroma. I've written in blue here the nerve that comes between the third and fourth toe, the most common area that patients complain of pain. They'll get pain between the bones here. They'll feel it on the bottom of the foot as well. And if you compress these black bones together, it bumps into the nerve and will create pain or shooting pains between these toes. Neuromas can be treated with either injections or surgery or shoe wear modifications. Another common place to have foot and ankle problems, we get sort of in an area here between the foot and ankle, but a extra bone, sometimes called the accessory navicular. It hurts right here on this prominent area, oftentimes in adolescents or teenagers to begin with, and sometimes in adults moving into their 40s. It's sometimes associated with a flat foot, sort of an archless foot. Gets more strain across here, and you can have more pain of the navicular or the posterior tib tendon where it comes in and inserts on the navicular. Another common area of pain is on the outside of the foot. We're going to have you rotate so that we can see this. The base of this bone here, called the fifth metatarsal, will oftentimes have a growth plate problem in adolescents, or sometimes in tendonitis in adults, and that's the prominence of that bone right there. Or you can have a bunionette. You remember that the bunion was on the inside of the foot. The bunionette deformity can be a prominence of the bone right here. Another thing we'll see is hammer toes, or toes that are bent up like this, and they'll have a prominence here over each of these knuckles. These sometimes are from shoe wear that is too tight or too short, or even high heels, which tend to scrunch up the toes, causing them to be in this position in the shoe. Hammer toes, when they get stuck, fixed, or painful, require everything from shoe wear modification all the way up to surgery. Another very common thing that we see is heel pain. There's a photograph that shows this real well, but when we draw the anatomy on the foot, the plantar fascia goes like this blue, all the way from the end of the toes, all the way into this area of the foot. Where this comes in and inserts on the bone, there's sometimes a bursa that will become inflamed right there on the bottom of the heel bone, so that there can be a combination of pain of the plantar fascia where it inserts on the calcaneus, and it will be pain first thing in the morning, pain when you step down on it after sitting for a while, and there's a variety of things we can do, everything from injections to physical therapy to modifications of the shoe or even surgery. And then the bursa tends to be a pain right there in the center of the heel, it's often called a stone bruise type sensation, that we can treat initially with modifications of your shoe. We're kind of rolling into the ankle between the junction of the foot and ankle, and we have the Achilles tendon, which again inserts onto the heel bone. I'll go ahead and talk about the Achilles tendon as part of the foot because the calcaneus here, where it inserts, is part of the foot, but the tendon goes up the back into the calf muscle. There can be pain either here, right where the Achilles tendon inserts onto the bone, or more typically an area up in this location where the blood flow is in short supply. there will be a little tiny area of pain, a little bit of a tiny area of inflammation that just doesn't seem to get better. It is a high maintenance type area of the Achilles tendon. Also call it a high misery, low serious area on the Achilles tendon. And oftentimes patients will have symptoms for months and months and months, and we have to initially treat it, evaluate it, find out how much of the tendon is involved, and then recommend treatment based on the severity of the Achilles tendon tear.